Hello, I'm Dr. Alan Schwartz. We're interviewing Joan Gahan, a client of Dr. Kachatrian's who was elected to try Dr. Kachatrian's protocol for the 3-week period. She's at the end of her 3 weeks, I believe, and we'll be asking her some questions in regard to how she's doing. Here's Ms. Gahan. Ms. Gahan, what was the reason you started the Dr. Kachatrian protocols a few weeks ago? What condition did you have that prompted this?
I had breast cancer.
How long have you had that for?
How long had I had it for? About 4 years.
And what have you done for the breast cancer during that time?
Nothing.
And why did you decide to try Dr. Kachatrian's protocol?
Well, because I hadn't done anything, and I had been taking care of a sick husband. And now my husband is gone, and doctor came over here, and I wanted to try his program because it was all natural.
And have you experienced any benefits or the converse during the 3 weeks that you've been using the protocol?
I have had no reactions that were bad. It was bleeding very badly. The breast was, and I actually was almost put out of a hotel because it was bleeding so badly. But it gradually, with his treatment, has become so it's bleeding less and less every day. And today it was just the next thing to being non-existent. It looks healthier. The skin is looking better. There never has been any pain, and there isn't any now.
Had you been having any intestinal bleeding during the 4-year period?
Yes.
When was that?
That was when I first came in.
For how long had you been having intestinal bleeding?
That was rather recent.
How many months would you guess?
About a month.
And how did you know you had intestinal bleeding? Were the stools red or dark?
Dark.
They were dark. Did that change at all after starting the protocol?
Yes, it did. It did lighten up and look a normal color again, and not before it was like diarrhea. There was so much blood in it, but it's more normal now.
That's good to hear. Have you noticed any changes in terms of energy, vitality, sleep quality, appetite, etc.?
My appetite is very good, and it wasn't before.
I see.
My energy level is way up compared to what it was. I was at the point where I was taking amino care. That was the only thing I was taking for energy. And even with that, I had practically no energy. I just had to push myself to do everything. And now, the better part of the day I have energy. In the evening I'm pretty tired. But
you also have another condition, which is a kind of a reactive airway disease. You're having trouble breathing.
Emphysema.
Emphysema. And has that changed any during the 3 weeks of the protocol, or is it about the same?
I think it's a little better. It seems to be a little bit better. There are longer periods of time when it's all right. The time that it's still bad is at night.
Okay.
But during the day it seems to be better.
Your overall impression of the protocol thus far would be what?
Well, I think it's very good, and I'd like to go on with it a little bit longer until I'm through.
Okay. And do you have any final comments?
Well, I haven't had any pain. I haven't had any fear. I haven't had any discomfort. I think Dr. Kachatrian is very good and very gentle.
Thank you very much, Joan. I'm Dr. Schwartz again, and we're interviewing a patient. Can you introduce yourself? Just say your first name.
Joan Gahan.
Okay. Joan, what medical conditions have you had in the past that have concerned you in more recent times?
Well, I've had asthma or chronic obstructive lung disease a long time, and that's been getting worse, steadily worse over the years.
Were you a smoker at one time, or exposed to cigarette smoke?
A couple of years in college, I smoked. The rest of the time, I think I worked for an airline that had a building where there were no windows, and there was no fresh air coming in anywhere. They recirculated the air, and 7 people died of lung disease before I found out about it.
Wow.
About 400 people smoking.
When were you diagnosed with breast cancer?
The early part of 2005.
And what kind of treatments did you get for the breast cancer?
I've never had any treatments.
And which breast was the breast cancer in?
The right one.
Is it still only in the right one, or is it?
Yes, it's as far as I know, it's still only in the right one. Last year in July, I had a CAT scan.
Yes.
And I didn't have anything else. And
it hadn't metastasized.
No.
And since then, have you had any evaluations to see if it's spread?
No.
How do you know you still have breast cancer?
Well, I've had a friend take some pictures of it.
Yes.
That are pretty clear.
Can you see the tumors on the surface of the skin?
Yes.
How large are they?
About so big.
That would be about
three of those.
Three or four inches in diameter, would you say?
About 3 inches in diameter.
Okay.
They go in pretty deep, I can tell from feeling.
Yes. Do they feel hard?
Yeah, most of the time they feel hard.
Does that change?
Yeah, it has. It's softer now.
And when did you start using Dr. Kachatrian's protocols? For how many days have you been on this?
This is my 8th day.
This is your 8th day. Prior to starting the protocol, you had some problems with intestinal bleeding. You were having black tarry stools. Is
That's
that
correct.
For how many days?
I don't know how many days. It's a couple months.
A couple months, pretty much every day?
Yes.
Is that still continuing?
It doesn't seem to be.
When did that stop?
Actually, about this second day of this protocol.
Second day of the protocol. And the tumor feels softer to you now than it did initially? Is that a fair statement? Have you noticed any change in your asthma or chronic obstructive pulmonary disease?
Very little, possibly a little bit, but I can't notice any change.
You haven't started the nebulization treatments yet?
No.
Okay. You've been getting intravenous treatments and enemas, is that a correct statement?
That's right.
Okay, and you're drinking the special water at home?
Yes, I am.
Yes, you are. Okay. What were your expectations on starting this protocol?
Well, I really didn't have any terrific expectations. I had hope.
You had hope?
I had hope that it would help.
But you didn't think...
I didn't know if it would or not. I didn't have any way of knowing.
That's a fair assessment to say. Were there any other benefits or the converse, were there any side effects that you're concerned about or have noticed?
I haven't had any side effects that bothered me at all. There's been no pain.
Are there any downsides to this protocol that you can see?
No, not really.
Not really. Is it inconvenient to have to come to the clinic on a regular basis?
Yes.
Is it worth it if we can get rid of the cancer?
Sure.
Okay. Would you recommend this protocol to others based on the limited experience you've had thus far?
Oh yes, because I've seen some people who have walked out looking like different people.
And you've already noticed a benefit in yourself as well.
Yeah.
Anything else you'd like to summarize or add?
Well, I'm very happy to have found you, Dr. Schwartz, and Dr. K. Both of you have been wonderful.
Thank you.
And you're working, and your wife has worked, everybody's worked very hard trying to help us. And I appreciate that.
Thank you. Dr. Kachatrian's protocol is designed to make the body healthy. It doesn't address specific diseases. By making all the cells healthy, we think, or he thinks, and I'm beginning to agree, that the body heals itself of just about every condition. And
I think that's right.
that appears to be taking place. We're into our second half of the protocol now. We've passed the 10th day for most people. You haven't reached the halfway point because you started a little later than others. and it's looking good so far. We look forward to interviewing you again at the end of the protocol to see if these improvements continue. Thank you very much.
You're welcome.
As we have heard from Ms. Gahan, the stools, which were black for several months, have now returned to normal color, indicating no more loss of blood. Her visible tumors have become softer, and this is only after 8 days of therapy, so it appears to be helping. We will not know for sure whether we achieve good results, probably for several months. The protocol will continue probably for another 12 days or so, and we hope to start the nebulization treatments tomorrow. We look forward to interviewing Ms. Gahan again at the end of this protocol. Thank you.